your friends. I know we haven't seen each other in person for a while, but we want to make sure there's some interactive pieces as well. So welcome again to the 2021 Roundtable event. We're so excited to see you all here. We're going to start with a little bit of organizational updates from our group, and then we'll move into our opening plenary. But again, feel free to use the chat box. I see folks are already chiming in with a hi from West Virginia, and I'm sure other states too can chime in there. Excited to see you all. So we are going to start with our little presentation. I'm going to share my screen. All right, and hopefully everybody can see our PowerPoint now. We are recording this, so just be aware of that. And if you have to jump off or jump on, you'll have a chance to go back and see some of the parts you've missed. Again, welcome. If you have any questions or want to just use the chat box further, feel free to do that. All right, I'm going to start. You all probably know me already. I'm Mandy Sorge, Executive Director of NAECS-SDE. We're going to kick it off with a little welcome from our president and vice president, and then we'll get into some content. So I'm going to start by letting Noelle Kelty do a little welcome. Noelle?
Thank you, Mandy. So good to see so many familiar names and faces today. Very exciting. So welcome to all of you. We know that we have so many returning members and new members this year. So very excited to dive into this year's roundtable with you and continue growing together. This has been a really big year for our organization. We've done a lot to kind of pivot our work, grow our work, to really truly support membership, especially in light of everything happening in the wake of the pandemic and so many changes in programs and services, all the increased funding, et cetera. We are here to serve, we are here to support, and this is your organization, so we're here to build with you. Through that, we've had a lot of the great lunch chat sessions that so many of you have participated in this year, a very active and informative listserv, so many increased program partnerships stemming from the work from our new 501c3 status and increased partnerships that we're so excited on the momentum that's being delivered through our executive committee, through our program committee, through our membership, et cetera. A lot of this couldn't be done without Mandy, who is our 1 year in-ish executive director, who works to keep the cats in line, which is very difficult sometimes, I think. And it's not only her organizational skills, but her leadership and her willingness to really partner and bring our committee and our work into the fold of all the Birth to 5 systems work happening in this country. I just want to send a poke, and I will do so again if I got the opportunity for engagement within NAECS-SDE as a member. This is your member organization. This is an opportunity in light of everything happening with our funds, with our programs, with growth of programs and services, and shifting into more and more weighing into our Birth to 5 mixed delivery system. This is our opportunity to come together nationally within our like roles to really support our programs and services. So we encourage you to today from 4 to 4:30, tomorrow and Wednesday, we have the networking happy hours. Great opportunity for new and returning members to make new relationships and reconnect with old ones, and oftentimes for somebody to bring a topic to the table that may be fun or serious to really delve into through those networking conversations. And also our communication, our various committees, including our membership committee, program committee, communications. Really, we're looking for those members that are interested in kind of stepping in to become more active, raise their voices, represent their state. So lots of opportunities within this organization, and we're fun. So just want to let you know, I'm thinking about something Robin said in an earlier meeting, that This is a meeting or a group of people that you really look forward to connecting with, because we're all in many ways in the same boat, and we can support and enhance the work that we do with each other. So I just wanted to give that welcome. Please enjoy the next several days. Any of us in executive committee and Mandy are open, willing to hear from you at any time. Anything that would enhance your position as a member and our position as an organization, we're happy to hear from you. And with that, I will hand this over to Robin, and welcome.
Good afternoon, everyone. I am so excited to be joining you as actually your newly elected vice president. I think this is my first time actually being in front of the group at large. I have been a member of the organization for several years, and I am this year leading the annual roundtable, which falls under the program committee. I again would like to stress the support of Mandy as the executive director, as well as the rest of the executive committee. It is a pleasure to work with them. And I also just want to acknowledge, and I always say this very dedicated group of state early childhood professionals from across the country, whose names are listed here, starting with Secretary Dr. Barbara Cooper, Tanya Costin from New Jersey. My screen is actually blocking Laura's last name, but Laura Goldthwait, who is an enormous resource for our committee. Obviously, Noelle, Erica King, who is now with Hatch Early Learning, who again is providing tech support to us so willingly. Dr. Kim Krasnowski, who is a newer member from Delaware, and Michigan representation in Pat Sargent. Michigan is definitely always there to lend a helping hand. But as you can see, this committee is very small, so I would invite all of you who are interested, after you've gone through the next few days, interested in helping us, lending a hand, getting in the weeds, helping us think about what you want to see as part of programming and professional development and professional learning. Please come join the program committee. We are here to be responsive to your needs. And with that, I am going to turn it, I guess, back over to Mandy.
Thanks so much, Robin, and thanks again to our program committee. Just to stress, if there's anything that you love about this conference, make sure you thank a program committee member, because they are who put the hard work in for the past year to get this thing planned. So appreciative of our program committee members. Now we're going to take a chance to look back at this past year. So as you can see by the slide, we've been busy. We did some onboarding of me and some coffee chats. We got requests from you all that we need more than just the annual roundtable. We need content throughout the year. So again, program committee was helping here, executive committee was helping here to plan office hours with experts, to form some new equity partnerships, and to make sure that we got a weekly email out to you all that was hopefully helpful with some job postings, some webinars, and some blogs. We've also been strategic planning. You'll hear more about that in just a moment. We've been maintaining and forming new partnerships, and we also have a new name that we'll announce in just a few minutes. So we have definitely been busy. In the next year, we're going to continue to strategic plan, and we're also going to be sustainability planning and fundraising. So if that's interesting to you, feel free to reach out to us. We'd love to hear your ideas around that. We will also be rebranding with the new name we're about to announce and starting communications planning around that. As a part of that, we'll be working on a website redesign and hopefully making it a little easier for you all to understand where you are in your membership, whether you need to renew, and hopefully have some private, just for state agency folks, just for full member conversations through that website redesign. And we'll also continue to enhance our partnerships and extend new partnerships to other national folks that are close to your work that would be helpful for you as members. So that you hear a little bit about strategic planning, and you'll hear some more at some upcoming events we have this week, we really wanted to get your member voice. You heard from Noelle, this is your association. So we want to make sure your voice is at the forefront of this strategic planning effort. So we have a lot of opportunities that we'll get into in just a moment for you to contribute to strategic planning. But the goal is to really have an updated mission statement, updated vision statement, some value statements for the association that represent your voice, as well as updated goals and objectives for the association. So to that end, we have partnered with School Readiness Consulting for this strategic planning process, and we have focus groups coming up tomorrow and Wednesday. So that's at 11 a.m. Eastern. It is through the same link. If you were able to get in today, you'll be able to get in tomorrow through the same link that you were sent. And these will be a chance for you all to contribute to the strategic planning process. So they will present you with some draft ideas that we have come up with as a leadership group, the executive committee and myself, through several leadership retreats and monthly meetings with School Readiness Consulting. And we want you all to have a chance to weigh in on that process. So please come to those. If you can't attend, we'll have an opportunity through the survey after Roundtable for you all to take a look at what was shared and then give your ideas through that. Some other ways that you can contribute are just to reach out for a coffee chat with any of us. I know Noelle and Robin both said, feel free to reach out to us at any time. But if you want to talk specifically about strategic planning, we can definitely make calls for that. We'll also be doing some more surveys, so be on the lookout for that through our partners at SRC. A little plug for elections coming up. So be on the lookout for that as well. After Roundtable, you'll be receiving more information on that. But if you'd like to be in one of these positions that you heard Noelle and Robin talking about, this is your opportunity. So reach out to us if that sounds appealing to you, and just be looking for more information on upcoming elections. Now to the big event. You all received the survey for a name change, and we had a lot of great ideas, a lot, so much so that we had to have extra meetings to decide what we thought would be the best name based off you all's ideas. And we're very excited about this announcement. So drum roll, please, at your desks for our new name. Our new name is NASLEE, the National Association of State Leaders in Early Education. We have a Twitter, so find our little handle right there at NASLEE_, and we have a hashtag for the Roundtable. So feel free to go on Twitter right now if you are an active Twitter follower, and give NASLEE a follow. And we'll have more to come on rebranding around NASLEE, but this was an idea that was submitted that really we think represents the voice of all of you as an organization. So excited to share that news with you today. And we also want to say congratulations to our member, Jim Lesko. Your name was chosen, you made the suggestion, and we thought it was the best representation of a new name for our organization. So we have to move forward with questions, but please feel free to put any other questions in the chat box or any reactions to our new name. And then we're going to move now into our plenary. So I'm going to now introduce our plenary speaker, Katie Ham, who is the Deputy Assistant Secretary for Early Childhood Development in the Office of Early Childhood Development at the U.S. Department of Health and Human Services. Katie, I'll turn it over to you.
Thank you so much, Mandy. Congratulations to Jim, and congrats to all of you on your new branding. I didn't know there was going to be breaking news, so excited that I could be part of it. That's very exciting. And a great time to be thinking about the role of the organization, and especially a hugely important time for state leaders and doing all that we can do to support state leaders in early childhood education. It's certainly a very exciting time, and I'm privileged to be here today with you all to talk a little bit more about where we are at the federal level on early childhood and what is to come. As Mandy said, my name is Katie Ham. I'm the Deputy Assistant Secretary for Early Childhood Development, at HHS. Prior to my role at HHS, I was at the Center for American Progress, and I also previously was a civil servant at OMB working on early childhood programs. So it's a great honor to be serving in the Biden-Harris administration and to see all of the work of many leaders across states kind of finally coming into fruition at the federal level, and hopefully being on the precipice of some really exciting investments in early childhood. So before we get started, I wanted to just kind of get a sense of who we have here today. Do we want to bring up the first poll? So I'm curious where you are coming to us from today. So what region of the country are you joining from? Like I said, I'm here in DC, but looking forward to hearing where people are located across the country today. Go ahead and click which region represents where you are today. Okay, it looks like we have a lot of folks from the Midwest. Way to represent. Thank you so much. Well, wherever you are today, I'm lucky to be with you. If we go to the next slide. I'm going to talk a little bit today about the American Rescue Plan. These are resources that Congress passed back in March that are in states available to support early childhood. You can go to the next slide. We have available to states right now a huge unprecedented amount of resources for early childhood education. In childcare alone, there is $39 billion to support the childcare industry that experienced widespread financial disruption as a result of the pandemic, but also to rethink how we look at childcare in this country and how we think about some of the investments that we make. We know that one of the reasons why there was widespread financial disruption is because we haven't invested in the childcare in the way that we should. So these resources not only help stabilize the childcare industry, but are designed to help lay the groundwork for a different way of investing in childcare. And so that includes covering the costs that parents that accrues to parents because of childcare. It includes investing in wages. It includes investing in the quality and supply of childcare. There's also $1 billion for Head Start. If you want to go to the next slide. So there's $24 billion in childcare investments for stabilization, $15 billion for CCDBG supplemental funding, and $1 billion for Head Start. So those resources in Head Start are really flexible. They're supplemental awards to grantees that are designed to help them meet broadly the needs that families and programs have during the pandemic. The $24 billion in childcare stabilization grants, those are grants that go directly to childcare providers that are broadly available to support them financially in the form of grants that they can use for nearly any kind of expense they could have. It can be related to rent or mortgage, PPE, cleaning supplies, any operating cost or to pay down their debt is an allowable use of those funds. And then there's this additional $15 billion in supplemental funding. And that can be used for any purpose of childcare funding. So next slide. So with these unprecedented resources for childcare, we are really encouraging at HHS for states to think about how to use these resources, like I said, to address some of the long-standing shortcomings in childcare as we kind of build out of the pandemic. So first and foremost, we want to stabilize the childcare sector. About half of states already have their applications up, so providers are currently applying for those funds, and we encourage any state that is able to expedite that process and get those applications and those funds out to do so. I know it's been sometimes difficult to get legislative approval and there are other hurdles, but really want to get those funds out as soon as possible so that they can address the needs that the childcare sector has now, and we prevent any other closures. And we especially help folks who are experiencing a workforce shortage. Those funds can be used to recruit and retain staff. And as we think about these funds broadly, we really want to be able to use them to increase provider payment rates. So right now, we know that in many areas of the country, the provider payment rates are too low to really allow providers to operate a quality program. So getting those payment rates up is one of the best ways we can improve quality, support a workforce, and make sure that providers can afford to accept those subsidies and families have choices. Improving our payment policies to make sure that providers are paid in real time when private pay families are paid, so that they're not having to float those costs for a long time. Wages and benefits, we know that we can't have a high quality early childhood system without providers who are well compensated and have benefits. And we know that we're also experiencing a workforce shortage, which I'll talk about in a little bit. We also want to build the supply of childcare for underserved populations, so that we know that there are areas of the country where there's a very limited supply of licensed childcare. And we don't want geography to determine the childcare that families have access to. So one of the things we're hoping that we can do with these funds, and states can do with these funds, is really address some of those supply issues, which are very much related to payment policies and wages and benefits and provider payment rates. But these funds can be used broadly for some of those supply building initiatives, like shared service models, providing grants so that providers know that they're going to have a stable source of financing if they operate in an area where many families can't afford to pay. And last but certainly not least, we want to make sure we're expanding access to childcare assistance. This is a really difficult time for families. Many of them are still feeling the effects of the pandemic. We know that in many families, parents have not been able to return to the workforce, and we want these funds to be able to help families afford childcare, so that those parents that were previously employed are able to return to the workforce. Next slide. So like I said, we are hearing from programs across the country that they are experiencing a workforce shortage, and the data does bear this out. We know that these resources can and should be deployed to help with the workforce shortage, and we want to support states in doing that. To level set a bit, this is where we are in terms of the child care workforce and recovering the jobs that were lost during the pandemic. So if you look at this red line down here, this 673, you see when the pandemic first hit, we saw a huge decline in the number of childcare workers, and we've been at a slow incline, and we're now at 90% of the level from before the pandemic, which might sound like good progress, and we think it is, but it means that we don't have workers for 10% of the kids who needed childcare before. So we really want to support states in strategies that will address this problem, so that we can get that number much closer to 100 and even grow the workforce. So if you go to the next slide, the Office of Child Care has produced several implementation guides that can support states in understanding how they can use the resources that they have to help with this workforce shortage and recruitment and retention. So there are some specific implementation guides around increasing provider rates, using grants and contracts, and increasing wages and benefits. So many of these strategies are already in use in states, but if you're a state that hasn't done this before and wants that kind of step-by-step guide, maybe examples of other states that are able to do this or have had success in doing this, you can click on those links and check out those websites, which will have the latest resources on how to use these ARP resources and make sure that they can be used in a way that can address the workforce shortage that so many folks are experiencing right now. Next slide. A couple weeks ago, HHS put out a Dear Colleague letter from the Office of Early Childhood Development, the Office of Child Care and the Office of Head Start, urging states to use the resources in ARP as well as their preschool development grant funds to the extent possible that use some of these strategies to address the workforce shortage. So you can, we'll make sure you have access to this link, but some of the strategies highlighted in the letter include improving those subsidy rates so the amount that goes to the provider is enough to implement some of those strategies that can recruit and retain a highly qualified workforce, increasing wages, whether that's through one-time incentives or wage increases, providing benefits. We've heard especially access to health insurance is a big concern of the early childhood workforce right now, funding scholarships to help folks attain higher credentials. Shared service models is a strategy that really can help with family childcare, especially to fulfill some of those business functions that family childcare providers might be hard pressed to be able to do. Funds can also be used for substitute pools so that when there are workforce shortages, that additional work is not falling to the current staff, which can exacerbate the workforce issues. Family childcare networks, which can really support family childcare providers who lack some of that infrastructure and support. And supporting staff wellness through things like breaks, mental health consultation, mental health services. We know all of that can make a difference. So check out that Dear Colleague letter. It also includes an appendix that has a lot of state examples. So if you are looking to model your efforts after a state, you can look at that appendix. It also can be helpful to point to another state, especially a state that maybe is geographically close or has some similar ideologies among leadership in the state to show how another state did it and how it might work in your state. Next slide. So I wanted to share just a couple of examples of how states are using their ARP funds to address the workforce shortage, because I know this is very much top of mind for a lot of states. Minnesota, with those stabilization grants, requires that providers use 70% of the funds to increase compensation, premium pay, or benefits. We know that payroll and benefits, labor, is a big cost of a child care program's operating budget. So that's a way to kind of directly make sure that those funds are felt by the workers. Maine has a stabilization grant formula that includes $200 per staff per month, and that amount must be paid directly to the staff. So they build in that bonus. So all that's to say that states very much have the ability to put terms and conditions and requirements in those stabilization grants to make sure that funds that go to providers are getting directly to the workers. And finally, Connecticut allows providers to opt in. This is an optional opportunity to receive a 25% additional funding increase for staff compensation. So you opt in and you agree that you're going to get more money, and you're going to agree that you're going to pass it on to staff. And you can use those funds for things like bonuses or wage increases, contributions to health insurance or staff retirement benefits, covering educational advancement opportunities or tuition reimbursement, and then covering staff's own childcare costs. We know that many childcare providers and staff are themselves parents, and they are feeling a similar crunch on the childcare front and in schools. Next slide. These are a few more examples. Arizona is, sorry, that should be AZ, not AR, is increasing the provider payment rates to the 75th percentile of the market rate for infants and toddlers. As you all know, infant toddler care is the most expensive, and providers and workers in those settings are often paid the least amount. So increasing those payment rates can especially help with the workforce. Oklahoma is using ARP funds to provide a childcare subsidy benefit for employees. They're also doing business training for providers to make sure that they can take advantage of opportunities for financing that come along, and increasing professional development through opportunities through stipends and training. Colorado is using their supplemental funds to help providers recruit and retain early childhood education professionals through grants for benefits, compensation, professional development, or hiring. They're also providing some free coursework and apprenticeship programs. So that can provide a pathway to recruiting a highly qualified workforce. So a lot of great work going on in states. You all are definitely our laboratories for early childhood education, and we'd love to hear more about what other states are doing, and also encourage you to get in touch with the Office of Child Care if you need ideas. There are a lot of examples to pull from, and we know that it has been a huge source of stress for a lot of our state leaders out there. So I've been talking a little bit more about the American Rescue Plan Act and what resources are currently available to states and to the child care sector to make sure that they can recover from the pandemic and have the resources to do so. But these are 2 to 3 year funds. So I know that planning for that short term can be challenging. And I'm going to talk a little bit now about the Build Back Better plan, if we want to go to the next slide, which is the administration's long-term vision for early childhood investment. What we're trying to do with Build Back Better is make sure that we're not just thinking about the next few years in recovery from the pandemic, but what do we want the long-term vision for early childhood to look like? We again know that when the pandemic started, early childhood was in a very precarious position because we have a chronically underfunded system. We have workers who have not been paid well in decades or if ever. We have families that really struggle to afford the high cost of childcare. So what the administration envisions with Build Back Better is a system that addresses all of those kind of chronic problems and puts in place a better system that helps us get to a program that is more accessible, more affordable, higher quality, paying workers what they deserve in terms of wages. So that's what I'm going to talk a little bit more about what the administration's vision for that is. This is a proposal. It's currently in Congress now. And if we want to go to the next slide, I can give you a little bit of an update. So what we're looking at reconciliation, budget reconciliation, as the mechanism for passing a major investment in early childhood education. As all of you know, the current split in the Senate is 50-50. To pass most legislation, you need 60 votes. So if you're not able to garner bipartisan support for legislation, you have to pass legislation through something called budget reconciliation. Budget reconciliation only needs 50 votes in the Senate, but there's a limit on what can be included. Right now, if you see the kind of House of Representatives symbol, that's where we are. The House is working through their process. They may soon pass a bill that would then go on to the Senate. Once it gets in the Senate, this cute little bird here is representing a bird bath, but it is not named after a bird. It is named after Senator Byrd. And the rule requires that anything that's part of budget reconciliation pertain to a budget provision, not a policy provision. So it's not the Schoolhouse Rock version of how a bill becomes a law. It's usually legislation that is much more succinct and speaks to here's the money and here's the money and how it gets used. It does not always come with all of the policy detail that you might see in the CCDBG Act or the Head Start Act because of the way that it moves through Congress. So all that's to say that, as there are these conversations, if you've been following it in the media, it's sometimes referred to as the X trillion dollar package. It's referred to as the reconciliation package, the president's Build Back Better agenda. That's all part of this process. And we're kind of waiting to see what Congress does and what comes out of it before we know what programs we're going to be implementing. So I'm going to talk a little bit today about what the president has proposed. We were pleased to see that the House reflected many of these priorities in their bill, but until we have legislation that passes Congress, we won't be able to speak with certainty about what these proposals are going to look like. So if you want to go to the next slide, I can talk more about what the president proposed. So what the president proposed is a $450 billion investment in early childhood. That's over a 10-year period. It includes $225 billion for the Child Care for American Families Plan, $200 billion for universal preschool, and then $25 billion for childcare infrastructure to invest in some of the facilities and quality and supply building. And that has been since rolled into the Child Care for American Families program. So I'll talk about these programs and what we might see, again, with the caveat that we don't know exactly what Congress will pass, and we'll have to share with you all what it looks like when that happens. So if you want to go to the next slide, I will talk a little bit more about the Child Care for American Families Plan. This is an entitlement to child care services for children birth to 5. So as many of you know, the way that childcare works now is as a block grant. States get a set amount of money, and then they kind of make decisions about how they want to spend this money. And they serve as many children as they're able to based on the funding that's been allocated. This would pretty significantly change that and say that states need to enroll eligible children, and they can serve as many children as they can enroll once the entitlement starts in that 4th year. What the House is carrying now is actually children would be eligible if they're in households earning up to 2 times the median income in their state. So that would mean about 87% of children in the US are income eligible for child care assistance. Their families would also need to be involved in an eligible activity like working, attending school, or job training. For those families that are eligible, they would not pay more than 7% of their income for childcare once the entitlement starts in that 4th year. And then the lowest income families, those earning below 75% of the state's median income, would get free childcare. There's a big emphasis on quality in a few ways. One is that the amount paid to providers would be equal to the cost of quality. So instead of asking states to set payments at the market rate, which often just reflects the low wages and limited quality that already exists in the childcare sector, this would require an estimate to look at how much does it cost to provide high quality childcare, and then paying at that rate. There's also a focus on quality standards, including low ratios, a developmentally appropriate curriculum, and last but not least, perhaps most importantly, increasing wages. So the president's plan includes a minimum wage of $15 an hour and pay parity for those early educators that have the same qualifications as elementary school teachers. Next slide. There's also a universal preschool program. This is a state-federal partnership available to all 3- and 4-year-olds, regardless of family income, regardless of whether the parent is engaged in an eligible work activity. The goal is to have states build towards all 3- and 4-year-olds eligible by the end of the program. I don't think I mentioned this specifically in childcare. I'll talk about it a little bit more, but we also see quality as inclusive for children with disabilities. So making sure that programs are accessible and are inclusive of all children. Like childcare, there's an emphasis on quality, on increasing wages, and both programs would save families a considerable amount of money because they would provide assistance to most families in the US who have young children. I'm going to go to the next slide and talk a little bit more about how the programs are designed to be inclusive of children with disabilities. Childcare providers will receive like I said, the true cost of quality, and that includes the cost of quality for children with disabilities and making sure that they have the supports that they need. All publicly funded preschool programs will consist of supportive classroom environments that are inclusive of children with disabilities. And there are policies throughout these programs to prioritize increasing access to early childhood programs that are inclusive of children with disabilities. So a lot of emphasis here on making sure that that children aren't left out from programs because of their disability or because of any other reason. And then lastly, I want to make sure that we envision all of these programs and the legislation mandates that these programs are mixed delivery. Most states already have a preschool mixed delivery system, but it's especially important when we think about preschool implementation that we're doing that in a way that allows preschool to be operated in all settings. And that's important for a few reasons. So when we say mixed delivery, we mean that preschool and childcare are available in family childcare, in Head Start settings, and childcare centers, and then mixed delivery would also, for preschool, include public schools. So we want to make sure that families have a choice about which setting works for them. It's also really important that we don't disrupt the childcare market by only putting preschool in schools and taking the 3 and 4-year-olds out of childcare programs. We know that many childcare providers can only operate in the black because they have those preschool classrooms. Infant and toddler care is extremely expensive to provide. So we need to make sure that when we're implementing these two programs that we are thinking about the birth to 5 system, and that mixed delivery is very much a part of that. So that's all I have in terms of the formal presentation. I want to get to questions, but before I do that, I was wondering if people could kind of put in the chat and share with me, what is the most pressing issue in the work you're doing right now? I covered the workforce, I covered the American Rescue Plan and some things that we're thinking about around quality. And many of those things resonate with you, but I'd love for folks to take a minute to put in the chat, what is the most pressing issue for your work right now? Looks like a lot of folks are sharing the teacher shortage, the workforce. I hope I didn't prime the pump too much on that and bias our audience. Well, keep those answers, or keep those answers coming. I'd love to follow along in the chat and see what is top of mind for folks. Mandy, have you received any questions that you want to throw out or invite people to ask them?
I don't think we have any in the chat box. I'm going to check in with Robin and Erica to see if I missed any coming through.
No, no exact questions, just comments in response to her question.
Okay.
Oh, okay. There is a question. I think it's coming.
Richard, feel free to go off mute too if that's easier. It's a longer question.
It is. Hi, Katie. Richard Lauer, Michigan Department of Ed, Director of Pre-K, as well as out of school time. Related to the mixed delivery system, which has been established from the beginning in Michigan, but thinking about how we adopt this and expand into the family group home environments, a center-based program that's been tried and true here. Even for 3 and 4-year-olds, family group home being 12 kids, and many family group homes having a wider spread of children, typically from birth to 12. For financial stability of that program, as well as recruitment for that program of existing family providers, how do you or the administration see existing providers adapting to pre-K expansion when they may only have 2 or 3 and 4-year-olds within that 12 or 14 versus establishing new targeted family group home providers to fit a universal pre-K model of 3 and 4s?
Yeah, I think it's a great question, and I'm glad to hear your kind of thinking behind this. We have a handful of states that have done this. And the models look different depending on the state. So I think I think it is very difficult for states to work with a single family childcare provider just for 2 or 3 slots. So I think the way that some entities have done that is by having a family childcare network that then is overseeing the slots that might be spread across a number of family childcare providers. We certainly don't want to incentivize family childcare to only include preschoolers, because we know that for infants and toddlers, there's also a large reliance on family childcare. So I think we would want to, one of the benefits of family childcare is often the mixed age model, and the fact that families can bring their 2-year-old and their 4-year-old to the same place, and they'll be in the same environment together throughout the day. So I think it is more about seeing what capacity already exists and then what capacity you need. Most states also tell us that they've seen a pretty steady decline in family childcare even before the pandemic. And for a lot of family childcare providers, the financing just doesn't work the way we funded childcare and the way we funded pre-K in the past. So this is an opportunity, if there is capacity that's been lost recently in states, to put grants and contracts in place so that those providers can come back and serve not just preschoolers, but infants and toddlers as well, because we'll be building out the childcare program at the same time as the Head Start, or sorry, the preschool program.
I think there's value for, especially in rural and in very sparsely populated areas. But as we were thinking along with my team in Michigan, as a retort to your comments, it's really about intentional planning, as you're indicating, and how the pre-K fits within the bigger system. So thank you for your comments.
Yeah, and we definitely want state leaders to be thinking about how these two programs complement each other, because the end user is often the same family, and the providers in some cases will be the same providers. So we also have many existing Head Start providers who we expect will be implementing the preschool program as they have the geographic reach throughout the country that a lot of states rely on.
Katie, we have a question that came in. I'm going to read off to you. The question's around the administrative home of the state pre-K and how the federal government envisions the partnership with states. So the question is it looking like this will be an adaptive partnership based on how and where state pre-K is currently administered?
That's a great question, and it also gives me an opportunity to talk about co-administration at the federal level. So right now, what the president proposed and the legislation puts the program at HHS in collaboration with the Department of Education. So at the federal level, we'll be kind of bringing together the expertise of both departments as we think about implementation. The current legislation allows the state to determine the lead agency for preschool. So the state can designate which agency it would like to lead on pre-K.
I haven't gotten any other questions yet in the chat box. Anyone want to go off mute and ask the question?
I will, Mandy. This is Ellen Freedy. Hi, Katie.
Hi.
Thank you so much for giving us this informative overview of what's going on. And in case you haven't seen the many chats I've said about President Biden being in New Jersey this morning, I'll just say that out loud too. It was very exciting to have him here visiting one of our state-funded pre-K classrooms, or two of them. My question is, what if a provision in the bill actually runs counter to the way in which a state can implement pre-K? And for example, in New Jersey, if we mess around too much with some of the provisions of pre-K, we run afoul of our Supreme Court. And how does that get worked out?
Yeah, that's a good question. And I would just encourage folks to go on mute. I think someone might have a TV in the background, so I'm getting a little feedback. So I think it's important to say that we don't really know what will be in the final legislation. But if there are specific things that you're concerned about, it would be helpful to hear that from you. Please feel free to reach out directly if there are provisions that would be difficult to implement. Generally speaking, the way that the legislation is structured is less about specific things that the state has to do and more about the plan they have to have in place for a particular outcome. So it's less about, for example, it doesn't dictate a particular curriculum or a particular structure for the preschool program, but it does talk about things like making sure you're prioritizing high need communities. It does talk about mixed delivery as something that needs to be in place. So a lot of that will be determined during the implementation process, but it's always helpful to hear from states if there are things that are looking like they will be difficult to implement so that we can take that into consideration and if needed, let our colleagues on the Hill know that.
Well, I'll just say specifically the thing that concerns me, and you know that I'm interested in this topic a lot, but it is the inclusion of family childcare, because we have home rule here and the school districts are specifically required to be in charge, to be the implementer through mixed delivery, but mixed delivery it does not include childcare here. And to dictate to the school districts that they must include family childcare is where I'm afraid we could get into some legal issues in New Jersey.
So Katie, someone put in the chat about providing additional funds for serving children who might take more support, like children with special needs or multilingual learners. Any info on that?
There is a lot of language in the bill that the House is carrying around making sure that there's both prioritization and support for children who have disabilities, who are dual language learners. There are not specific provisions about the type of supports, but there is definitely a requirement that states are speaking to that in their state plan.
Helpful. No other questions coming through the chat. Another call for anyone who wants to go off mute and ask Katie a question, or if you want to use the chat box.
Mandy, did you have any questions, or you want to wrap up?
I guess my only question, and you hit on this a little bit, is around working with our closing plenary speaker, Miriam Calderon, and the folks at ED. Anything you want to add there about your collaboration and work together around this?
Yeah, that's a great question. So HHS and Ed have a long history of working together since Race to the Top Early Learning Challenge, and now with the Preschool Development Grant Program. So we have, since Miriam and I arrived at our respective agencies, been working really closely together on the policy development and planning for this. We are excited for the opportunity to work together. I think at Ed, we're especially looking forward to partnering on issues related to children with disabilities. There's a good depth of experience at Ed around the provision of educational services for migrant children and children experiencing homelessness. So it really feels like an opportunity to bring the expertise that Ed has, obviously their work with school districts and state education agencies. HHS has the majority, if not all, of the early childhood education programs with Head Start, with childcare. And so we'll really have an opportunity to think about the birth to 5 system and work with Ed to make sure it's not just birth to 5, but we're also thinking about those elementary school years as well. So it's a huge opportunity that we're really looking forward to.
Great. Excited about that partnership. We have one more question to the chat box. Since we have state leaders here on the call, what can they do now to prepare as we're waiting to see what passes?
That's a great question. I think, I think following kind of what's in the legislation and looking at some of your existing programs and thinking about, there's language in the legislation about what a transitional plan would look like for some of these programs. So thinking about, how would your state think about preschool standards? How would you think about making sure you're looking at high need communities, gathering information about the children you're currently serving, the programs you're currently funding, and thinking about what a strategy would look like to create buy-in in your state and move forward with some of these goals, I think are great exercises. Once we have legislation, we'll also pull together a briefing to share what's in that final package that ultimately passes. So I can share that information with Mandy to make sure it gets out to everyone and that you all can join. But I think any ground softening to start having conversations with other leaders in your state who work on childcare, who work on preschool, who work on IDA to say, hey, this legislation's here. How would we think about it in our state? Your state landscape is so different that's starting to think about what's in there and how you might think about some of the provisions in the legislation, I think is a really good idea.
Super helpful advice for our state leaders. Just want to thank you so much, Katie, for taking the time to join us today and give our state leaders on the call information that I know they were hungry to hear about. So really just appreciate you taking the time. And thank you for coming. At this point, we're going to give a virtual round of applause to Katie, and we're going to move into our next plenary. We do not have a built-in break right here. You will get a break after this plenary. Of course, we know with Zoom, if you need a bio break, feel free. But at this time, we're going to move into our second plenary. We have a plenary called Supporting Educator and Child Wellbeing Through Mental Health Supports and Trauma-Informed Practices. As all of our content on the agenda, you will see has been reflected from the survey that we sent out. So these were top 3 issues, the issues of the day, plus the fact that we wanted to hear from our friends at the federal government as well. So this was a top issue that was requested by all of you. We know it's with the pandemic, this is a huge issue. So want to take the time right now to turn this over to Lisa, and she's going to introduce our panel. So Dr. Lisa Fox, who's the principal investigator for the National Center for Pyramid Model Innovations. So I'm going to turn it over to you, Lisa.
Great, thank you so much. So I'm really privileged to be invited to join you in this important panel discussion about educator in child well-being through mental health supports and trauma-informed practices. I know many of you in the work of the National Center for Pyramid Model Innovations. My colleagues and I have been working with state systems and programs to implement systems and practices related to young children's social emotional outcomes and providing effective interventions for children with social emotional delay and behavior challenges. And I think all of us collectively as early educators, systems leaders, and researchers, I think we all are really aware of the importance of social emotional well-being and the relationship of that to early learning outcomes. I think we're also very aware through the last decade of research about the vulnerability of children during this period of development, with research that illustrates the impact of adverse childhood experiences and trauma on the trajectory of a child's development, and actually the lifelong impact on a child's trajectory of development. So today, though, we're going to expand that discussion. We're going to talk about those topics. We're also going to think about the critical importance of practitioner well-being and their capacity to guide children and support families. So I think collectively, we know some children struggle with social emotional wellness and mental health challenges that impact their growth and development. However, the COVID-19 pandemic has really intensified those challenges significantly. And for example, recently, the American Academy of Pediatrics, the American Academy of Child and Adolescent Psychiatry, and the Children's Hospital Association issued a position paper, and they described this context we're in as a mental health state of emergency. I think that's very sobering and highly relevant to this work. And it really accelerates the need for all of us to think about how we provide those mental health supports and services to children, their families, and staff, so that all of us can nurture child and family resilience and foster child development. I think in the pandemic, we know children, families, practitioners have experienced a host of hardships: the loss of loved ones, food insecurity, unemployment, and social isolation. And researchers have documented that the greater the number of those hardships, the greater the impact on family well-being, child social emotional wellness, and practitioners who we rely on to provide these early education services. So today in the panel discussion, we're going to learn more about what we know from research, and we're going to hear from state leaders about the system supports in New Jersey and in Wisconsin to address these concerns. So we're going to start with Dr. Kate Gallagher. I'm really pleased to introduce her. Who'll kick us off on the panel. She's from the Buffett Early Childhood Institute at the University of Nebraska. And she's going to start a discussion about telling us a little more about what we know about educator well-being and the impact of that on this topic. Dr. Gallagher? Kate, are you able to unmute? Can't.
I thought I had. Apologies.
No worries.
Good afternoon. It is really a pleasure to be here talking with you today about something that's been a passion of mine for several years. And in the context of the pandemic, it's become even more urgent. A lot of what I'm going to share with you today is a bit of a historical walk and leading to where we need to be now. I got to this work working as a teacher and a teacher educator and a program director in childcare. And after studying relationships, it became pretty clear that parent-child relationships, teacher-child relationships, the teacher well-being was the crux of what we needed to know. So today I'm going to give a quick overview of some things we've learned about stress, teacher well-being, and implications for the work conditions we provide for teachers. Next slide, Mandy. And a little bit about the Buffett Institute. Our efforts engage research, policy, and practice and outreach in pursuit of our mission and vision. And we're a relatively young organization with 7 years of work around our 2 signature programs, which include eliminating opportunity gaps for young children and families and elevating the workforce. For today, I'll bring some research and thoughts to 3 questions. What is well-being? Why does teacher well-being matter? And how might we learn to improve our supports in the workplace? Next slide. And I can't actually see the slide you're showing, Mandy, for some reason on the way my screen is set up. So, we're on the right one. Life is perfect. Okay, thank you. In simple terms, well-being can be described as judging life positively and feeling good. But there are many definitions of well-being. And Carol Riff was an early researcher in this space, and her efforts at defining, describing, and assessing adult well-being are really comprehensive. And before I share what Riff learned, I'd like to ask you to pop in the chat what you think of when you hear the term well-being. And are folks popping in the chat? What do you think of when you think of well-being? Safety, connectedness, yeah. Content, positive outlook, lack of stressors, happiness and health. Love these, thank you. I'm going to have you, Mandy, click through what Riff has landed on, and you have captured several of them today. Self-acceptance is one, personal growth, having a purpose in life. And we think about this as a mission sometimes. And I think it's a really important thing to think about when we think about early childhood professionals. Positive relationships with others, environmental mastery, and autonomy. So this is what Riff described in 2013. I'm having a little tech problem, forgive me. Okay, here we go. Thanks. It's worth noting up until this point, research on teacher well-being has focused primarily on depression within the teacher. Most of the research has looked at what the teacher brings. And while that's reasonable, because we know in warm one-on-one interactions that define what quality is in early care and education, it's important to note that while depression is a factor, thinking about it's on the burden of the professional to be well is a little problematic. But Bob Whitaker and colleagues surveyed early Head Start and Head Start staff in Pennsylvania several years ago to better understand sources of stress. And as a primary source of stress, they had examined demands, control, and support in the workplace. They examined the degree to which staff could afford basic necessities and the amount of childhood trauma they had experienced. Thanks, Mandy. All right, so next slide. Among the many things learned from this work, we learned that both workplace stress and teachers' personal symptoms of depression contributed negatively to their relationships with students. I want to say that again. Workplace stress and depression contributed meaningful to teacher-child conflict. While there's a bit of that's a duh, we had focused heavily on things that were associated with depression and mindfulness. Next slide. Thanks, Mandy. So inspired by some emergent work that was happening with Patricia Jennings at Virginia and the work of Whitaker and colleagues, the Institute of Medicine and the National Research Council included teacher well-being in their framework of contributions to professional practice for those teaching children birth through 8 years old. So want to click to the book, Mandy, and then click to the framework. Thank you. And then there's 2 more clicks. I have a clicky slides today. So I think a really important thing to think about in this Transforming the Workforce document, which really only got at the tip of the importance of workforce well-being, when they did their framework to what contributes to professional practice and child outcomes, they noted that relationships were the most proximal and important in terms of the nearness to child outcomes, and that well-being of the practitioner was at the center. That said, you'll find this is the shortest chapter in the book. And since then, there has been a wealth of research around workforce well-being. Next slide. So one of the factors that relieved sources of stress on teachers' health and their professional functioning has been mindfulness. Mindfulness is defined as an awareness that arises through paying attention on purpose in the present moment and non-judgmentally. And if you haven't heard about mindfulness, you haven't turned on social media in a few years, right? So I want to point out again, mindfulness is this wonderful tool. Next slide, Mandy. And in fact, mindfulness was associated with less teacher-child relationship conflict, and that effect has been explained by decreasing depression. So it is a powerful tool, especially on the mood and social emotional well-being of the teacher herself. But it became clear that for some teachers, this healthy option of mindfulness wasn't going to be a good option for improving their work. And not all teaching professionals will practice mindfulness. It's just not for everybody. And remember that we've also learned that workplace stress matters for teacher-student relationships as much as depression. So how can we increase teachers' well-being in other ways, specifically through supports in the workplace? Next slide. So what we've been doing is thinking about the teacher well-being from an ecological framework and thinking and focusing on the workplace itself. And one thing you'll want to note in this slide is that we attribute some things to individual factors, but we also attribute it even more so to contextual factors. Next slide, Mandy. And this is the clicky one I told you about. So at the center of the model is the child and the relationships and interactions that are predictive of children's outcomes. Essential to that is teacher well-being. We in Nebraska are defining quality as warm, one-on-one, language-rich interactions with a caring adult. That is what quality is, the degree to which a child experiences that, and teacher well-being is essential for that. Next slides, and you can go through these kind of quickly. And we have at the core here teaching role, personal factors, knowledge and competencies. But from a contextual perspective, we've got the practice environment and work conditions, organizational factors and leadership, professional regulations and policy, and social and cultural factors. In fact, in provider surveys we did this year in the context of COVID, we asked if providers had experienced discrimination in the context of the pandemic with the understanding that their race or ethnicity put them at higher risk for COVID. And 9% of individuals responded that they had received some discrimination based on the perception that their race or ethnicity put them more at risk for COVID. If you know Nebraska, there are fewer people who of color and of other races and ethnicities in terms of ratios in the state. And so you'll know that it's a pretty powerful thing that people experienced in the context of the pandemic. Next slide, Andy. So we've done some contextual research, most before the pandemic, but some since. And we, with a group of teachers in Head Start and Early Head Start, we broke them into classes of more and less positive. And we found that things like their job role and circumstances in the workplace impacted their well-being. Those who were more positive in their well-being were more likely to have a bachelor's degree, were more likely to have a higher status role, were not surprisingly more likely to have higher pay, and they also had lower ACEs. We saw higher ACEs among those who were less positive, but they were also likely to have these less status roles. I will say, I'm going to tell you a little bit about focus groups, then I'll talk a little about our pandemic work. In focus groups, and this is what I'm going to advocate for, folks. I'm going to advocate in the context of the pandemic and beyond. We need to be asking professionals how they can be well, as opposed to designing interventions that don't take their perspectives into account. Next slide. This is Sandy. This is the wages and well-being. Thank you. And so we found that teachers face workplace obstacles in experiencing well-being. While again, no one at this table is surprised, again, it's the focus on the workplace. And they were able to give us a lot of details about that. They explained that wages only explained a portion of their well-being. And wage inequity was a serious source of pain and conflict. They shared with us that, and these wage inequities were across roles, specifically teacher assistant and teacher roles. Both teachers and teacher assistants saw themselves doing very similar work and getting very different compensation. So this sense of inequity in the workplace was a very dominant theme, and I think is really important to think about. Next slide. We also asked them what could make well-being in the workplace better, and they share the following: ability to take breaks and vacations. Their employers provided them breaks conceptually and vacation time, and they were not able to take it. By the way, this has been exacerbated in the pandemic, where almost all programs have a shortage of staff. They wanted input on their professional learning, particularly for child's social emotional behavior. In our second COVID survey in Nebraska, we asked specifically what kinds of professional learning that they would want the most. And the top three were child social emotional behavior, COVID information, and clearly, logically, and stress relief. Again, this is in a population that typically doesn't endorse high levels of depression or mood disorders. In the context of the pandemic, they did. They pointed to depressive symptoms, they pointed to unprecedented stress, and it just sends home the message that they really need time for relationship building, and professional planning was another thing they pointed out. And they were asking, practically begging, for reflective supervision. So they really wanted that ongoing feedback and connection with their supervisor around how things were going. So we need to continue to know more about the ecology of well-being. And we have an opportunity right now to really find out more about how staff, how early childhood professionals are doing. We need to identify workplace policies and supports for well-being with a lens on the individual and systemic supports, and not assume that it's just about wages. Theoretically, we think that how people, what predicts burnout and leaving the profession, in addition to being very stressful years, is the loss of a sense of mission and purpose, that when the stressors are piled so high, the sense of mission and purpose goes down and people can no longer bear it and they leave the field. So we need to prioritize teacher well-being. Thanks so much. That's my formal comments.
Kate, thank you so much. That was really informative. When we go to breakouts, you'll have a chance to go to a breakout session with any of our speakers. And so we'll look forward to unpacking it some more. I do think we're going to have a little bit of time before we move to breakout for some questions. So please put your questions in the chat, and Mandy and I will keep up with them. And if we have time at the end of our panel, we can pose some of those. So I think that was really great for setting the stage of some of these challenging circumstances that we're struggling with. So our next presenter to give us a high-level overview of the work that's happening in New Jersey is Dr. Caitlin Mulcahy, and she'll be presenting around their systems work addressing mental health supports. Caitlin?
Thanks, Lisa. Hi, everybody. Thanks so much for being here today. As many of you, I'm sure, also have in your states, New Jersey has been, I think, for a number of years, really maximizing the opportunities that have existed in early childhood. And it feels as though, I don't know if you all feel this way, but it feels like everything's just finally coming together. And we've been talking about this need to focus on relational, emotional, and social health for however long we've been all doing it. And finally, the opportunities are here. What's nice in our state is that I think we did a lot of good foundational work ahead of time. And so I did not prepare slides. If you want some more information, certainly you can email me. I'll put my email in the chat if you feel you want to know more. But I thought it was, these are examples that are specific to New Jersey. And I think for me, I would be interested in you thinking about how something like what we're doing in New Jersey might fit to your state. So most recently through our preschool development grant funds, Birth to 5, we've been able to launch what's known to us as the Professional Formation Center for the Early Relational Health Workforce. So that's a lot of words. So early relational health, I'll just put the definition in the chat if that's not a familiar definition to you. This is from the Center of the Study of Social Policy, some work by Dave Willis. And in our state, we really are trying to have early relational health be what we call the core and the common ground around which all early childhood systems work. So you notice it's not exactly mental health. And the reason we're utilizing the term early relational health is because we understand how mental health is developed in young children. And that is through, like Dr. Gallagher just showed us, through their relationships. And so in this case, this definition really speaks about the context of nurturing, warm, responsive, early parent or caregiver-child relationships. And also that contextual model, same as we also just saw from Dr. Gallagher, that those families are surrounded by safe communities with strong trust and social connectedness. So the idea of early relational health, that we all come to wellness through the experience of safe, stable, nurturing relationships, is, we believe, the province of all of us who work in early childhood. So for us, we're looking at the birth through 3rd grade system, including our Part C programming, private childcare, public preschool, all of our home-based, evidence-based home visiting models, really thinking about our doula formation, even prenatally, really thinking about how these relationships need to start from the very beginning of family formation. And then we need to support the workforce going forward to recognize how critical their relationships are. And we understand that that only works if the workforce themselves, as Dr. Gallagher just shared with us, is feeling supported themselves. So the idea of an early relational health workforce is to provide some both support and education to that workforce in topics such as the impact of trauma on young children, the importance of relationships towards development, the idea that culture and context potentiate relationships and then relationships potentiate development. And so we're working to do this in a few different ways. The two longest that we've had in our state really are two what we call professional formation programs. Professional formation is a term that we use distinct from professional development even, or training, which is meant to say that the work that we do in early childhood incorporates ways of knowing, ways of doing, and ways of being. So some of that reflection piece that Dr. Gallagher just showed us, that really when we think of the workforce development, we're thinking of all three things, not just what do you know, not just what do you do, but also how are you in the what you do. So that's the ways of being, or the ways of being with. So we have two professional formation activities that have been going on in our state for some time. The first is an original curriculum called Keeping Babies and Children in Mind, which is offered to the entire multidisciplinary workforce who works with birth through 8. And it's a 21-hour curriculum. It's a little long, 7 sessions, 3 hours each, that focus on infant and early childhood development, relational, emotional, and social development, impact of trauma specifically, and the importance of reflection. So this is a training that, look at me training, a professional formation activity that has been provided by a number of different funding streams in our state. Initially started after Superstorm Sandy. So this was actually Superstorm Sandy block grant funding that helped develop the curriculum. And it was offered to the 10 counties most affected by Superstorm Sandy in the year following, so 2013. And then our Department of Human Services Division of Family Development then broadened that out to all counties. And what was nice about that funding was that we were able to use it for all disciplines, regardless of where the early childhood professional worked. So our Department of Health folks, our Department of Education folks, our Department of Human Services folks who regulate childcare in our state, all were welcome. And we've been having that curriculum in our state without cost to the participants since 2013. To date, we've trained over 11,000 people in most of the workshops. Not everybody can take all 7. They are set to stand alone as well. So if you can only take one, you get what that one tells you. But the idea there is to help raise the floor of awareness of everything I talked about before: relational, emotional, and social health, the impact of trauma, and the importance of reflection for the entire workforce. Connected with that is our pyramid model work, which is also focused on the idea of decreasing reactivity to increase responsivity, all through reflectivity. So that's how our pyramid coaching is utilized throughout the state, both in our public preschool, which happens through a preschool intervention and referral specialist, who is the practitioner coach to our public preschool programs, as well as in our private childcare programs, where we have both practitioner and program coaching. We also are beginning to do some work with early intervention, which is our Part C program. They have recently changed their state systemic improvement plan to center early relational health as part of their work, so that practitioners in early intervention can also see themselves as focused on the relationship as critical to development. So while these aren't, mental health supports as maybe one might initially think about, we do believe that what they're doing is having a developmentally appropriate focus on the importance of adult nurturing relationships in children's lives in order to advance pro-social and healthy mental health for all. The last piece I'll share is that the workforce themselves, we recognize, does not have that many opportunities for reflection. And so we've been able to share throughout our state, again, to no cost to the participant, what we're calling 3 C's groups. This has been just from the pandemic on, when it was really clear that our early childhood workforce was even more isolated than maybe they had been before, that many of them were out of work, that many of them who had, communities in their workplaces were now separate from them. We developed these groups called 3 C's, which is Conversations for Connection, Comfort, and Calm, which are 6 weeks in a row, about an hour each, offered at many, many different times during the day. So early morning, lunchtime, late afternoon, evening, Saturday mornings. And they're really just about reflective practice and bringing people together for connection, comfort, and calm. We do offer as well 4 C's groups, which adds a 4th C, which is about consultation, which are actually reflective consultation groups that will provide reflective consultation hours for practitioners, and those last longer and are a longer relationship. And that allows for our workforce to be able to access reflectivity in a few different ways, maybe in a shorter term aspect, if that's what they can tolerate in their schedules, or longer term in the 4 C's, adding that consultation piece. Just a few other pieces that I think are relevant and important to recognize. There's also a large program happening in our state around improving inclusive practices in our preschool through 12 programs, which we believe is really important towards the relational emotional health of the children who are in need of additional assistance in school to reduce self-containment and to increase inclusivity in our programs. That's an important piece of new professional learning that we're able to support across the state. And we have a New Jersey Office of Resiliency, which is a new office that actually is sitting in the Department of Children and Families, but is meant to be cross-departmental and has a strong connection with our New Jersey Education Association, which is about really educating our educators in adverse childhood experiences, but even more than that, in protective and compensatory experiences, so PACEs, and focusing on those strengths that exist in the community. Connected to that is a healing-centered engagement pilot that's also bringing some of that work across our public schools to help both early childhood and K through 12 understand more about really lifting up what's right about you, not just what's wrong with you, and not even just what happened to you, which we understand in trauma, but also what's right about you, and really centering and focusing on those strengths. So it's a lot of little programs, really impactful programs though. And again, I'm happy to share more about all of them either in the breakout spaces, or I'll put my email in the chat here. So if you have any questions about any of the ones that we discussed, happy to answer anything that you are interested in learning about. Thank you.
Thanks, Caitlin. That is fascinating. And I'm sure people are going to be very interested in all of those things. I think this is the first I've heard of a State Office of Resiliency, which is really exciting. And don't forget, folks, as you're listening, we might have a little bit of time before we go to breakouts for some general questions. So if you have some for Kate Gallagher or Caitlin McCahey, please put them in the chat. So we're going to move on to Wisconsin and what they're doing. We have Julie Betchkol and Jenny Duran from the Wisconsin Alliance for Infant Mental Health.
Thank you, Lisa. And I'll add that Jenny and I have another prior commitment, so we won't be able to make the breakout room session. So I'll reiterate what Lisa's been saying, happy to address questions, and I'll pop our emails into the chat as well. So Wisconsin has been working to implement infrastructure for the pyramid model since 2009. And the Wisconsin Alliance for Infant Mental Health has held the contract for coordination of that effort through Wisconsin's Department of Children and Families. The Wisconsin Alliance for Infant Mental Health is a small nonprofit organization that has existed in Wisconsin to address the mission or the vision statement for the last 20 years. Next slide, please. With some expanded funding for our pyramid model through preschool development grant funds, we've been able to establish a regional lead position. And so I've been connected to the coordination work since 2009. And Jenny, do you want to talk a little bit about your role and how you came to pyramid model work, please?
Yeah, absolutely. I am Jenny Durand, and I am one of the region leads for Pyramid Model. And so as I joined WeAIM and did some external coaching support and other Pyramid Model support, and as we received funding, we were able to grow our cadre of regional supports, which we are able to attend state-led regional collaboration meetings, connect directly with programs and supports as they become program-wide sites, an opportunity to coach programs as well and be that connecting point between the state level and the direct service level work that we do.
So Wisconsin's pyramid model efforts have always been, from a training perspective, embedded within all organizations who provide professional development for providers of early care and education in Wisconsin. So public pre-K, childcare, and Head Start programs. We are just leaning into conversations with our Part C providers and are connected with our Family Resource Center folks and McVie funded home visiting projects as well. And so the regional leads support embedded providers of training content in that gold box. Wisconsin has taken the original CEPHL content and overlaid it with infant and early childhood mental health concepts in an 8-part series. So it was interesting to hear Dr. McCauley's talking about 21 hours. We have 24 hours of training in across 8 parts that are delivered throughout the state. And so what WeAIM holds is the training for programs that are working to go program-wide with our program-wide implementation. And so we provide TPOT reliability training, TPTOES reliability training, the team launch, we provide a practice-based coaching through the pyramid model lens, and we provide refreshers for our program-wide implementing sites. Can you animate the slide, please? We have currently 67 implementing programs across 143 individual sites, and 35 of those individual sites are located in 3 communities that are working to implement community-wide. Interestingly, and as Dr. Gallagher was talking about the importance of mindfulness in our, as we revamped our training content, we have embedded mindful opportunities at the start of each session as a way to practice and reinforce the idea of self-care throughout our sessions. And also to create the context for our trainers and our supporters of individuals to also engage in mindful reflection right at the beginning of our training opportunities. Next slide, please. Our regional leads, so we are informed by a parallel process, right? I think that that's been the true focus of this whole session is how do we hold the holders? With our regional lead model, we've been able to provide what sounds very much like the three C's opportunity, right? To have a coaches connection for practitioner coaches to meet monthly. We've embedded a lot of opportunity for reflection in breakout rooms and individually to sort of hold folks in the conversation of connectedness, right? And calm, right? And we've provided a lot of reassurance. We have regional communities of practice for anyone in each of our 5 regions to be who are connected around infant and early mental health, early childhood mental health, and pyramid model work to gather together for shared learning opportunities. We've been focusing on culturally responsive practices and the role of implicit bias in our interpretation of a young child's behavior and in our interpretation of the adults who provide supports for young children as well. We hold monthly pyramid model institutes that this year are primarily focused around supporting and calming our programs as we lean into using the pyramid model implementation data system, a national data system. So we've been really trying to be strategic about providing specific examples and to have opportunities for folks to ask and answer questions related to data input, right? Data accuracy. And then new this year, we're supporting our, what we call our external coaches, so our program coaches, to meet together to reflect around elements of supporting policy, clear, articulate teaching and child guidance policy, and in holding directors in the what can feel like nearly impossible work they've been asked to do in the last 2 years. Next slide, please. We aim hosts the Wisconsin Infant and Early Childhood Mental Health Conference. And this year, our whole theme was around holding the holders, right? How do we center ourselves so that we can hold others who are holding children? Next slide, please. We have really tried to be intentional this year. And so this week, all of our implementing programs got a box of chocolates and little puzzles and little gifts of acknowledgement and reminders that we're here and available for them. Just received a beautiful email this morning about the timing of the box and just the idea of knowing that we are holding others in mind, I think is feeling very deeply relational on both sides. We try to write handwritten notes to anyone who's presenting or sharing in our statewide meetings, and just really, really trying to focus on a relational understanding. Next slide. We also have, there was supposed to be a little magic wand. We've waved the magic wand, right? And are holding folks to this understanding that we know that they are implementing the pyramid model, even if they're not able to get us data, right? Or even if they're not able to attend the meetings. So, Jenny.
So at we also really strive to connect these dots between the infant and early childhood mental health and pyramid model, knowing right that infant mental health is synonymous with social emotional development. So WeAIM holds the infant mental health endorsement coordination in Wisconsin. And we've created this opportunity for our pyramid model community of practice members to receive support in completing their application, a really relational cohort approach to documenting to obtain their endorsement, with hopes, right, that their experience will allow them to support practitioners to pursue their own endorsement. So our infant mental health endorsement also is really this outreach between early care and education professionals, grounded in really uplifting and recognizing their way of being and knowing and doing their work with young children and families. You can animate the slide onto the next picture. And we also facilitate a year-long experiential learning opportunity through our Reflective Supervision Learning Collaborative for supervisors to expand their toolbox as they support their practitioners in their programs. We've opened this opportunity to program directors in our program-wide sites, so it is a multiple discipline supervisor collaborative. Early care and education supervisors are supported by a cadre of infant mental health consultants to bring reflective supervision practices into their agencies and programs. One of our community-wide implementation groups has supported their pyramid model implementation programs to attend the Reflective Supervision Learning Collaborative, as well as earn their infant mental health endorsement and hold those within their community. You can go on to the next slide. WeAIM is also considered the statewide agency lead for infant and early childhood social and emotional learning. So Wisconsin doesn't yet have a statewide infrastructure to support a cadre of infant and early childhood mental health consultants, though we are connected to consultants in Wisconsin through our other work, like the Reflective Supervision Learning Collaborative and endorsement. Because we're a nonprofit, we can advocate for Wisconsin's youngest, allowing us to create things like our Speak for Wisconsin Babies and infant and early childhood mental health consultation toolboxes for people in our state to use in their own advocacy work to bring this awareness of these things to our state. The Department of Children and Families also consults with WeAIM as they build statewide infrastructures, and WeAIM is currently providing technical advisory on an effort to establish and understand infant and early childhood mental health, including the role of infant and early childhood mental health consultants. You can go on to our final slide. So we have built a wonderful website with lots of information on all these things. And as Julie said, we are sad to say we are not able to attend the next portion for your questions, but our website contains lots of information, and I see Julie just put it in the chat. So feel free to check out our website, and our contact information is on there as well if you would like to connect and learn more about what we are doing in Wisconsin.
Thank you so much. Thanks, Julie and Jenny. How are you with us for a minute? Can we?
Absolutely.
Oh, sure. So we do have just a few minutes, not very long. Does anybody in the audience have a question for any of our presenters? While you're typing this in, I'm going to lob one out to Wisconsin since they have to leave us soon. And I'm wondering about, so you've been at this a while, you shared that state map that really showed some good reach across your state. And I'm wondering about sustainability, and if you have tips as people think about their systems building work, what are considerations for sustainability and scaling, or conversations you've had about it? I think we've just been exposed now to 2 states that have amazing investments, and I think for systems leaders, thinking about that with scaling and sustainability is really critically important. Yeah, Wisconsin, you want to start?
Jenny, can I take this one? Is that all right? Okay. So again, we've been at this for a dozen years now. And I really think what has sustained our work is embedding pyramid model efforts into our regional professional learning models. And having, so we hold the content, we create the content, and we support other agencies and organizations to deliver that content in a way that is embedded within the work that those agencies do, so that we don't have full-time pyramid model trainers, right? Or full-time pyramid model coaches. They're doing a little bit of everything. And I think because of that, the pyramid model reach has spread. I think more folks understand the need for systemic program level support for practitioners to apply practices. So for sure, embedded within that, that stands out for me. I really believe that that's what has sustained our work. People like to train and coach in the model because it works.
Mm-hmm. That's interesting, Julie, that you kind of rolled it back to systemic level supports, because that builds on what Dr. Gallagher had shared with us around kind of where some of the stressors and maybe some of the solutions of stressors for practitioners. So New Jersey, do you have reflections about sustainability? And
Sure. So what I didn't mention was that our pyramid model work and our Keeping Babies and Children in Mind curriculum are part of our quality rating improvement system too, which is now, started in private childcare, but has been extended now to our Head Start, early Head Start programming and our public preschool. So similar standards across funding modalities. And in some of the iterations, we've been having the first modules of pyramid earlier in our star rating system, if that makes sense. So right now, a 5-star rating would be a fully implementing program that's doing TPOTS and has a coach, but a 3-star rating, which is the starting of our rating system, even though it's a 3, that's where we start. That's programs who have completed module 1, really to explain and embed that idea that those relationships and nurturing and safe environments are what we expect to be the entrance level of quality. And that has been very helpful, because again, it centers relationships as at the beginning. And while yes, sometimes for programs, I have to do this training, I don't know why I'm here, that voluntold kind of experience. We do believe that the content is so compelling that it does help both the practitioner in that moment, the teacher in that moment, or the family support worker in that moment, but also contributes towards quality. I also think what we're trying to also do is change the idea that pyramid specifically is just about challenging behaviors and only for those kids who are rising to the top of the pyramid, and really make sure that people understand it's actually about the workforce, because that's still a misconception, I think, at least in our state. So we want to be sure that what we're talking about is you as the adult who care for children are going to be benefited by knowing this information and being given some of these teaching practices to try out, but also to have a conversation around what it's like to be in this role, particularly now with a community that is understaffed, overwhelmed. I think everyone probably would agree this September was way harder than last September. It was hard to imagine last September. And so I think and in our public preschools that we have the pyramid model as standard in our publicly funded preschools is put us in such a different place from the start, because it really showed the importance of the practitioner to the work and the success of children's education.
Great, thanks for sharing that. I'm going to ask Julie one more question before you go, Wisconsin goes, and then I have one for Dr. Gallagher. And if anybody has some other questions, please type them in. So a question from the audience was, how do you ensure fidelity to the pyramid model implementation with that regional model that you're using? And
right, great question. So we also, attending the pyramid model training, any of the strands is built into our QRIS system as well. So we use a mentoring process to bring on new trainers, and the mentor ensures that they know the content and works with the trainer and signs off on their ability to provide the training content solo. Implementation at the program-wide level is we hire and contract with the external coaches. So WeAIM supports the external program coaches who build the capacity utilizing all of the data tools that are part of program-wide implementation. So we hold program-wide implementation a little bit closer from a fidelity perspective. Does that address the question?
Yes, I think so.
Okay.
Great. So Kate, I want to roll back to you. I thought your data was fascinating, and I immediately saw all kinds of intersections with what we're talking about and what's been shared with New Jersey and Wisconsin in their pretty remarkable systems building work. And I'm wondering, as you've engaged in this work, looking at practitioner wellness and stress, what kinds of things have you seen have been really effective? So what might we learn from what you've learned so far from states as people are thinking about their state systems?
Thanks, Lisa. And I actually want to say that I was taking wild notes on New Jersey and Wisconsin. Okay, we have some great programs in Nebraska. We have something called Rooted in Relationships that uses a collective impact approach with communities to incorporate pyramid. But we haven't really expanded it much in the context of the pandemic and in the context of our PDG Birth to 5 work. In other words, we've been kind of at capacity for rolling that work out. So some of the kinds of things that have been helping during the pandemic and some of the kinds of things it was based on. So I'll back up. During the pandemic, it was the first time we had providers endorse depressive symptoms in any serious amounts, while a quarter of them were endorsing depressive symptoms. Previously, maybe 11% we had seen. So we knew these world circumstances were really hitting providers hard. When asked what they wanted, initially they really wanted financial resources. They wanted to know their programs were going to continue. They wanted to know, family providers wanted to know they weren't going to lose their homes. Some did, by the way, some did. And so in addition, something in our state that had been a bit of a barrier was the need for information and information flow feedback systems. And so early on in the pandemic, the need to reach providers was so intense, and we actually didn't have a database with all the licensed providers in the state that could be reached. We didn't have communication tools. And so in the context of the pandemic, Nebraska built a resource and referral system to pull providers in. It's not comprehensive and full, but so information is something that I think is really important. I imagine a lot of states experience this as the pandemic landed, folks didn't know where to get reliable information. And we're still struggling with that a bit, aren't we? They are wanting to stay healthy and wanting to retain their populations. So there's a lot of controversy around masking. And so they've asked for some supports around research on masking, which, by the way, we don't have too much of yet, right? Yeah, we don't have too much there. So financial resources, information, and finally, they want professional learning that they weigh in on. So they want it targeted toward the issues that they bring up. I'm going to say, I think a silver lining of this has been, in the past, I sometimes experienced working with teachers and providers that they did not understand the connection between their behavior and emotions and children's behaviors and emotions. Mm-hmm. And I think there have been multiple points, mostly through chat conversations that have been facilitated by our NAECS and our Nebraska Infant Mental Health Association, that had chat sessions to really support the well-being of the teachers so that they could reflect back on how their lived emotions were not separate from children's behavior. And that's been that's something that's so important. So those are some of the kinds of things. I don't know if I got what you were looking for, Lisa.
Yes, you did. That was great. Thank you for responding. Let me look and see if we have any more chat questions. We did hear, loved rooted in the relationships. And yes, I love rooted in relationships as well, and actually pass on the evaluation report from that effort to everybody I meet. So I'm going to have to close us down. This was great, kind of a teaser of some really interesting systems work. Wisconsin will reach out to you individually to find out more. And then I think we're going to go to breakouts where we can dig more deeply into both topics. So I'm going to turn it back to the National Association host to tell us about breakout rooms and how we'll do that.
Thanks so much, Lisa, and thanks to all our panelists. We appreciate you coming and sharing. I know this is such useful information for our members, and very excited for breakouts and digging a little deeper. So we're going to have a break from now until what is 3:15 Eastern time. But before we go to break, just want to explain what's going to happen when we come back. So when we come back, we'll have a breakout room with Dr. Gallagher, and also a breakout room with Caitlin from New Jersey. And you'll have a chance to choose which one you want to go to. Who do you want to dig a little deeper in? You got a little teaser during this panel. So then you'll have a chance to go to one of those two breakout rooms. And there will be a facilitator in each breakout room, but we would love if you all are able to engage. This is one of the times where we're able to be more interactive despite, not being in person. So that'll be a chance for you all to have deeper conversations and just connect across states. So when you come back at 3:15 Eastern, you'll see an option to go in one of those two breakout rooms. We're sticking around, and we will get ready to go to breakout sessions really quick. I want to, if folks join late, announce to you and re-announce our new name, as you see on the screen here, National Association of State Leaders in Early Education, NASLEE. A lot easier to say and much more inclusive of all the folks in our membership. There's also some confusion about the Twitter. Just want to clarify, I know it's kind of small on here, but this is the new Twitter handle. There is an underscore after the name. NASLEE was already taken. So we're NASLEE _. So make sure you search for that in order to start following us. There's already been some great Twitter activity. So be sure to get in on that. And there's the hashtag as well. So right now we're gonna, as mentioned before, go to our breakouts with Caitlin and Kate. So we're gonna open those breakout rooms. I think Erica, if you're available to open them, we'll do that. And you should be able to see which one you can and be able to pick which one you'd like to go to.
Sure.
Thanks, Erica. I'm going to stop sharing so it's very clear on your screen. And just so you know, while it's coming up, when you go in there, just to remind you all, you will have a facilitator. One of our lovely program committee members will be facilitating these breakout rooms in each of the rooms. So you'll have a chance to interact in there and ask your deep dive questions of our presenters. So once that pops up for you to go to a breakout room, you'll have a chance to go into those.
Sorry, Mandy, how long did you want these to be again? They're 45 minutes, right?
45 minutes. Mm-hmm. Thank you, Erica.
Sure.
And also a little plug while we're waiting, when you come back, you'll have a chance to join our networking happy hour. So we hope to see you guys for that. That'll be another chance to interact and reconnect with folks that we don't get to see in person all the time.
Enjoy your conversations.
Getting pulled back into this main room after our great breakouts. I know we had some great content today, and now we're going to take some time to socialize. So this is our virtual happy hour, our networking happy hour. If you're able to stay, totally understand it. Some folks have some meetings after this, and on East Coast, we're about ready to wind down the day, but some of you on the West Coast might have some other meetings now. For those of you who are able to stay, going to give some background on how this is going to work in case you didn't attend last year. So this is our best way at trying to figure out how to get you guys into some small group conversations, some hallway conversations you would have in person, or conversations waiting at the bar to get a drink. So we're going to try to do that through breakout rooms. Oh, and for our presenters who are signing off, thank you so much. We appreciate Kate, Caitlin, Lisa for joining in for the breakouts. Appreciate you so much. And now we're going to move into doing some randomly assigned breakouts so that you can get those conversations in around that you might have in person. So we're going to recreate these breakout rooms, and Erica and Robin, I'm going to attempt to do this. And we're going to put you in some small groups. So it'll be random. So you'll get a chance to meet a new face or maybe see a familiar face and reconnect. And then we'll come back into the main room and maybe get a chance to hear from, and see we have some associate members on here, some folks who have been retired who maybe can give us some insight. So we'll start with our random breakout rooms. I'll go ahead and get those started, and then I'll bring you back. All right, here we go.
Hey,
Erica.
Mandy, I I am going to head out for the day.
Okay, thank you so much.
No problem. It's been great, the parts that I have been able to